I'm here not only as a research scientist from Wilder, but also as part of a collaborative, the Minnesota Strengthening Families Affected by Incarceration Collaborative, actually. And you will see on your agendas that there are hashtags and other things with MNSFAI, and that's what that stands for. But we are here today because this is a second forum that we're having. I was going to mention too, we want you to have your phones on. You can put them on quiet, that'd be great, but we want you to tweet during this time if you're a person that does that, because we will have obviously I don't, because I don't know how to even say it. But use that hashtag to tweet anything that you've learned, and we will be putting something together. It's a tweet wall and a storyboard. But we brought you all here today to share some findings of the analysis of the 2013 Minnesota Student Survey. And for the first time in 2013, they included two questions, or actually one question, that asked about the students' experience with parental incarceration. And so we've been doing analysis for the past almost year. We have a group of people in the room that have worked on not only the analysis side of things, but making some of the infographics and going around the state and sharing some of the information. And we have plans for other things too, to do presentations outside of the Twin Cities. But we've learned that at least 1 in 6 youth in Minnesota currently have an incarcerated parent, or formerly have had or have an incarcerated parent. And we also have a lot of other things that we wanted to share today in respect to chemical health and how they've self-reported some chemical health and chemical using in the Minnesota Student Survey. Throughout this time together, we'd like you to think about how you can incorporate this information into the work that you do and what you would need in order to move forward. Because we're guessing that you may work with youth and with families that are affected by incarceration, but you may not even know it. And so we want you to help us as a collaborative figure out what you need in order to be able to be a better service provider, a better therapist, a better chemical health person in general, or just be able to work with families better. I'm going to now move this on to introducing Dr. Rebecca Shlafer, who is also a member of the Minnesota Strengthening Families Affected by Incarceration Collaborative. She's also an assistant professor at the University of Minnesota. She will be presenting analysis from the student survey, some of which you will find on the infographic that we emailed you yesterday, and that's also in your packet. And here's Rebecca.
Thanks, Julie, and thank you to all of you for taking time out of your afternoon. I know particularly as the semesters are ending at local universities and kids are finishing last months of school, it is a busy, busy time, so thank you for being here. I am excited to share data from recent analyses that we've done with the Minnesota Student Survey, and I just want to briefly acknowledge Laurel Davis, who's a graduate student with me at the U, and Julie, who helped both put this together, but do some of the data analysis that we'll present today. I have the very tough task of presenting a lot of data to you in a little bit of time, and I've always told myself as a scientist, like, never shove data down anybody's throats and then run, but that's what we're gonna do. The goal here is to kind of give you a teaser and just talk about some of the findings that we are seeing now with regard to chemical health and substance use among youth with incarcerated parents. And before I dive into the data and information about the survey, I really want to put a caveat out here that as we start to look through these numbers and look at the descriptive statistics, they are just that, right? These are group averages, and we know that youth with incarcerated parents have a variety of different experiences, and that no child's experience or their family circumstances in the context of incarceration are the same. And so simply because we see elevated risks, as you'll see as we move forward, I think it's important for us to keep in mind that these are not in any way deterministic of all bad outcomes for all kids with incarcerated parents. So let's just keep that in mind. But I think we'll also see we have a lot of work to do. So as many of you probably know, if you have youth in the Minnesota school system, or if you work with youth, the Minnesota Student Survey is probably very familiar to you. This is a statewide survey of Minnesota youth looking at both background characteristics, things like family structure, who they live with, the neighborhoods they live in, their school outcomes. And for those of you who attended the last forum here, we looked at academic outcomes among youth with incarcerated parents, but also some health behaviors, out of school time, and risk behaviors, including some of the things we're going to talk about today, such as substance use, but also risky sexual behaviors. The survey is administered in 5th, 8th, 9th, and 11th graders, but today we're really only going to talk about 8th, 9th, and 11th graders because the 5th graders were not asked the question of primary interest to us about parental incarceration. That question was deemed to be too sensitive to ask 5th graders, so that's something we can think about when we consider how much 5th graders already know. The survey is administered every 3 years, and as Julie mentioned, it was in 2013 that our collaborative really advocated with the creators of the Minnesota Student Survey as they were working to revise this survey to say, hey, this is a growing public health issue. We don't have nearly enough data in Minnesota. What can we do to leverage existing data sources? And one of the goals of our collaborative was to do just that, identify existing data sources that we could either tap into or add items to in a way that we could leverage existing data sources to get information about this critical issue in our state. So that is what we did. So as Julie mentioned, we added an item about parental incarceration, which states, have any of your parents or guardians ever been in jail or prison? And there were 3 response options. None of my parents or guardians has ever been in jail or prison. Yes, I have a parent or guardian in jail or prison right now, and for the purposes as we move forward, I'll talk about those as our currently incarcerated parents. Or yes, I have had a parent or guardian in jail or prison in the past. A very small proportion of students indicated yes to both of those 2 response options, so they are currently experiencing this and experienced this in the past. And as we talk about the limitations to this survey, what we don't know is if that's the same parent, so this is dad who's in now and dad was in the past, or if this was mom who was in the past and dad who's in now. And we can't really discern that with this level and this kind of survey. So what we've done here is actually collapsed for those kids who indicated both yes in the past and yes currently. We put them in the current category, and we're making comparisons across those mutually exclusive categories for the purposes of today's presentation. So just something to keep in mind. So when we think about who are the kids we're going to talk about today and what do we know about them, this particular sample of Minnesota public school students, and I should back up and say that this is a survey that was done in over 450 public schools to more than 160,000 youth in our state. So as a scientist, I like to have those big sample sizes. It feels pretty good to be looking at a group of kids of this magnitude and be able to draw some conclusions about the status of youth in our state. So 51% of them were female, on average about 15 years old. A third of them indicated that they were living in poverty, and this was looking at whether or not they were receiving free and reduced price lunch, didn't have a place to stay, were homeless or highly mobile, or had some elements of food insecurity. And about 9% of them self-identified as having an individualized education plan or receipt of special education services of some kind. And you can see here that 75% of the sample self-identified as white, but you can see the racial breakdown there among the other 25% of youth in this sample. So as Julie mentioned, when we look at just this parental incarceration question, we can see that 1 in 6 Minnesota youth has or has had a parent involved in the criminal justice system in our state when we think about a previous incarceration of jail or prison. We like to let people pause and sort of soak on that for a minute and think about what that means, 1 in 6. I will often tell people, if you think about the fact that if 1 in 6 kids had autism or 1 in 6 kids had juvenile diabetes, we would be talking about that a whole lot more. And we are just not talking about parental incarceration, despite its tremendous magnitude impacting our families and our communities. And when you consider the fact that Minnesota has one of the lowest incarceration rates in the country, and we're looking at a number like 1 in 6, it's really a powerful thing to think about. What are we doing to the next generation of our children? So 2% currently experiencing the incarceration of a parent, 14% has experienced that in the past. And when we start to look at, and I just want to back up and say one thing. In a previous infographic, we described the marked disparities by race. It will come as no surprise to anyone in this audience, probably, that there are tremendous and pretty horrifying disparities by race about the experience of incarceration, current and former incarceration. We've also been able to look at these data, and I think the second infographic that you have explores these differences by school setting. So looking at the public school kids, we also have some data which we won't present today, looking at youth in alternative learning centers and kids in juvenile correctional facilities. And no surprise that we see really dramatic disparities there and sort of these leading intergenerational patterns of incarceration. So things to keep in mind. So when we look at what we know about parental incarceration as it relates to substance use, I'm going to dive in and sort of walk us through the key elements that are in the infographic. So what we see here, and just to orient you to kind of all of these figures as we move forward, the little orange person is our reference group for all of these, and that's never had an experience with incarceration, with parental incarceration. Compared to the green group, which has had that experience in the past, so the formerly incarcerated parents, and the blue is currently incarcerated. So these are youth who are self-reporting their engagement in high-risk substance use behavior with their own self-reports of their parents' experience with incarceration. So you can see here, for example, that that youth with a currently incarcerated parent were more than 3 times as likely to have tried alcohol by the age of 12. So we see very early initiation and higher rates of early initiation for alcohol use for those kids who are experiencing the incarceration of a parent either currently or in the past. We see that pattern holds here when we think about having had at least 1 drink in the last 30 days, so trying to get at some of the recency issues. So again, youth with a current incarcerated parent are more than 3 times as likely than those youth who have never had an incarcerated parent, and more than twice as likely when they have a formerly incarcerated parent. And here you can see that the patterns of binge drinking are very similar. When we move on and look at tobacco use as another risk behavior, when we think about youth and exposure to substances, youth with a currently incarcerated parent are 4 times more likely to report using tobacco in the last 30 days compared to their peers who don't have an incarcerated parent. And they're 7 times more likely to be frequently smoking. So 20 of the last 30 days they report being, in this case, basically smokers. So 7 times more likely than their peers who don't have an incarcerated parent. And these patterns really persist as we start looking at the use of other drugs, perhaps other drugs that really have some damaging consequences for health and development now, but also some long-term consequences for engaging in the criminal justice system. So again, we can look at youth with a currently incarcerated parent. They are more or almost 11 times more likely to report having used marijuana. I think it's important here to remember that we're talking about, on average, these are almost 15-year-old kids, but early initiation of drugs and alcohol, generally speaking. They are almost 5 times more likely than their peers without an incarcerated parent to have reported using any kind of other illegal drugs, whether that be meth, cocaine, or heroin, at least once, so trying these drugs or using them regularly compared to their peers. And again, you can see here that even those kids who have just had this experience in the past, who are not currently experiencing this, but have had this somewhere in their history, they're more than 3 times as likely that their peers without an incarcerated parent. And that same pattern persists here for the use of prescription drugs that were not prescribed to them. We can also think about the way that this substance use impacts their behavior and their outcomes. And so one of the things that we did, and I know these numbers get pretty, or the font here gets pretty small, but you have all these data on your infographic in front of you as well. So we've also found that there are pretty damaging consequences of substance use among these youth for behaviors in and out of school and other domains of their lives. So we can look at, for instance, when it's just 1 in 20, that 5% of youth who have never had an incarcerated parent, they report spending 1 or more days using drugs or alcohol or getting over their effects. That's quite different compared to that blue bar there, the 1 in 5 youth with a currently incarcerated parent who are saying, yeah, I'm using drugs and alcohol and spending my time getting over those effects. This is looking at the impact of using substances on missing work or school or neglecting other major responsibilities. So again, we see a pretty powerful pattern where about 1 in 5, 1 in 6 kids with a currently or formerly incarcerated parent are experiencing this compared to their peers. Alcohol and drug use are causing the youth problems with the law. Again, thinking about this 1 in 6, 15% of the kids who have a currently incarcerated parent are saying the substance use I'm doing right now is already causing me challenges with the law. And I think one of the things that we've really reflected on with this is just this early initiation, the potential early initiation and patterns of getting engaged in substance use and potentially abuse, and these powerful patterns of intergenerational patterns of substance use and potentially incarceration that we're very concerned about. Thinking about violence as it relates to, so this is the youth hit someone or became violent while using drugs or alcohol. You can see there that it's 12% of youth with a currently incarcerated parent compared to 4% and 1% respectively. And then the last part here, thinking about mental health, and this is alcohol or drug use left the youth feeling depressed, agitated, paranoid, or unable to concentrate. And again, among those youth with a currently incarcerated parent, it's 1 in 5 and drops precipitously from there. And I think what's interesting for us is to really start to probe into this a little bit more. I'm looking forward to diving in, and our next forum will be about mental health. That's the plug for the next one. But when we start thinking about the way the consequences of use impact academics, they impact mental health, they impact the cycles or the risk for engagement in the criminal justice system or the juvenile justice system. I think we know that these domains in kids' lives are intersecting. We have a really nice opportunity here to start to dive into some of that, looking at our Minnesota youth and trying to understand this a bit more. So key findings as you'll walk away from here thinking about, we know that youth are at increased risk of use of alcohol, tobacco, and other drugs. They're, from what we see here, those with currently or formerly incarcerated parents are using substances at an earlier age. They have more frequent use and they report heavier use of these substances. We also see there are more consequences to their use across a variety of domains. And I think you saw that pattern pretty clearly here, that there is a difference between a currently incarcerated parent having that experience with a parent in jail or prison now versus having that experience in the past. And there's mixed literature on whether or not there is this sort of after effect or that lingering effect of having this experience, 5 years ago, 10 years ago, when you were an infant. Does that effect carry over? And I think that this is really important when we think about how do we respond to youth who are currently in crisis and experiencing the trauma of having an incarcerated parent, but also not forgetting that clearly there are long-lasting effects for youth as they move across their development, and really thinking about what does that mean for intervention and policy. And then I think we'll take questions at the end. Thank you. And then limitations, so hold it, write it down. And then thinking about just limitations, and I've hinted at some of these, right? But I think it's important as we move forward and have our conversation. Large data sets offer so many valuable things, but they just often lead us to asking more and more questions. So we don't know which parent is incarcerated, right? We can try to parse out some of the data around where the youth was living, but we don't know whether that was mom or dad. That presents a lot of challenges, and we know that the literature does say that there are some important differences, particularly as it relates to the parent's involvement in the child's life leading up to the incarceration. We don't know how frequent the engagement was in the criminal justice system. Is this a mom or a dad who's cycling in and out of the criminal justice system, or somebody who's experiencing a long-term incarceration? Was this 5 years ago? Was it 5 minutes ago? Was it 5 months ago? We don't know how recent the trauma was in this child's life, or if there was trauma, right? So was this a dad who's incarcerated that the youth says, yeah, I know my dad's in jail because he's never been in my life? What does that mean for this kid compared to a mom who might have been incarcerated and been the primary caregiver? Again, I hinted at this idea of duration. Is it a long time ago, and was the incarceration a short-term incarceration or a long-term incarceration? We think about too the parent, the location of the parent. Are we talking about a jail or a prison incarceration? There are some really important differences when we think about access between the parent and the child. If they're housed in a local county facility, there may be increased opportunities for visitation. The family may have more opportunities to be transported there. There may be local busing or not. If you're incarcerated in the state of Minnesota and you're a woman, you go to one location if you're serving a felony offense, right? In Shakopee. And if your family's from Bemidji or northern Minnesota, that's a several-hour drive. And if your family has limited resources, that may really prohibit your ability to get and have access to that family. So location and the type of facility matters. We know that there are differences in the types of facilities based on programming and access to resources and things like that. So that certainly matters too when we think about the parent-child relationship. I will stop there. I don't know. I told you I was going to dump a lot of data and then leave. Not leave, but like not engage in a rich discussion yet, because I know we have such a fabulous panel of people lined up who are going to give a lot more humanity and human perspective to a lot of numbers. So I'm looking forward to that, and I will turn it back over to Julie, unless there's. I can take one question or a couple questions if you have it.
Well, I was just trying to find a statistic.
Yeah. Yep.
They're not only looking at temporal incarceration, but their chances of being addicted to drugs or alcohol becomes that much greater.
Absolutely, and you can see your infographic includes one stat that I didn't present here, but that youth with a currently incarcerated parent are 11 times more likely to have already been involved in chemical health treatment of some kind. At such a young age. So I think this point is a really important one, thinking about age at initiation and what we know about early use of alcohol and other drugs and the trajectory that it puts kids on, and the really powerful consequences of criminalizing youth at such a young age and the disparities by race in criminalizing some of that behavior, and the pathway that it puts youth on for future incarceration. Any other data questions I can answer before I turn it over? Awesome, thank you.